Good evening, all. Professor Jennifer Harrison-Hauer, Fortis College Community Health Nursing, Week 4 lecture. Let's get started. We're going to begin with Chapter 4. And hopefully everyone's had a chance to go over their readings. Okay. Government, the law, and policy activism. As a future nurse, you want to be cognizant, you want to be aware of the laws that affect your practice and the care that you provide. You want to understand the factors that influence the current and future roles for nurses, and the public health system is crucial for better health policy for the nation. So you want to be aware of the policies in your area and the laws in your area. This knowledge and the motivation to be an agent of change in the discipline and the community are necessary ingredients for success as a population-centered nurse. So if you're not up to date with current laws, you want to begin to be aware of them. Be aware of what's going on in the news and in the world and your state and what have you. So policy, these are some definitions you definitely want to make sure that you're aware of. Policy is a settled course of action, which could be a law, a regulation, or a voluntary practice to be followed by a government or institution to obtain a desired end. And so public policy is described as all governmental activities, direct or indirect, that influence the lives of all citizens, hence public, there. And then your health policy, in contrast, is a set of course of action to obtain a desired health outcome for an individual, for a family or a group, community or society. These policies are made not only by governments, but also by such institutions like your health department or other healthcare agencies, a community or a professional organization. Politics is the art of influencing others to accept a specific course of action. Law is a system of privileges and processes by which people solve problems based on established rules. It is intended to minimize the use of force. So be aware of these definitions, okay? And then government role in healthcare. So government is the ultimate authority in society and is designated to enforce the policies, whether it's related to health, economic, social welfare, or any society. The executive branch, so you're thinking of your president, the Department of Health and Human Services, legislative, and judicial. Make sure you're aware of these definitions. The role of the legislative branch is to identify problems and propose, debate, pass, and modify laws, okay? And so think of your Congress and your House of Representatives, where your judicial branch interprets laws and their meaning. They overturn Roe versus Wade because they interpret the law to mean this, that, and the other. And so they are your federal, state, and your local courts, your Supreme Courts, your local courts in your area. And then as far as police power, so police power is that power that allows states to act to protect the health, safety, and welfare of their citizens, such as police power. So just be aware of that. And then the trends and shifts in governmental roles. Consider that the government's role in healthcare at both the state and federal level, it just began gradually. And so you have the public health systems that were in place, your Social Security Acts, all of this is listed in your text here that evolved over time to protect the health and welfare of the citizens of the United States. And so myself, I am a commissioned officer with the United States Public Health Service. That is me there in action. I was actually deployed to a Border Patrol mission. We were screening individuals from other countries that came over to the United States. make sure that they were free of any communicable diseases and what have you. And so government healthcare, you have your direct services, financing, useful information, policy setting, and public protection. And pretty much the government provides healthcare to members. Think of the military, state and local governments, and what have you. An example of there we go. All right. So then you're looking at the Healthy People 2030, the goals and objectives that are listed here. In 79, the Surgeon General had a report about the health of the United States, and therefore that's when your first Healthy People began. And so every 10 years, there's a report that focuses on promoting health, preventing diseases, and what have you. Organizational agencies that influence health. Think of your World Health Organization, your World Health Assembly, your Department of Health and Human Services for us federally over in the United States, your Institute of Health. These different agencies listed here, they influence the health of its citizens on different levels. And then you have the World Health Organization here providing aid in another country. And so your federal non-health agencies, think of your Department of Defense, Department of Labor, then your state and local health departments as well provide care and influence care at the local level or again, on your state level. Excuse me, okay. So funding is huge and it shapes the roles and tasks of a population-based nurse. When there's budget restrictions and what have you in providing the care that you need to provide, you may be limited. There may be limitations on what the funding is designated for. So you want to be aware of that going in and into, if you decide to do school nursing or emergency preparedness or what have you, they all operate on a budget. Okay, here we go. Let me just make sure. Okay, all right. So when you're thinking of the law on healthcare, there's constitutional law, which provides overall guidance for selected practice situations. Then you have legislative and regulations, which is legislation is law that comes from the legislation branches of the federal and state or the local government, such as your Nurse Practice Act for each state is governed by the legislation in that area. And then you have your judicial law as well, which is based on court or jury decisions, case laws. And so your scope of practice it defines your nursing, what you are able to do based on credentials and practices for your profession. And so you need to be aware of your Nurse Practice Act in the state that you plan to practice. You plan practice in multiple states, you need to be aware of that as well, so you can keep yourself legal and out of trouble as much as you are able to do so. And so legal issues affecting healthcare practices, your school health legislation, they have a minimum, they follow by school health legislation, there's a minimum of services that have to provide to children, such as making sure that the children are immunized and they keep record of that. Home care and hospice and correctional nursing, they all have legal guidelines that they are required to follow. And so the number and types of laws in healthcare are increasing, they're changing. Nurses need to be involved in this at the policy level so that we can have some type of say in the profession that we practice in. So for most professional nurses, action is nurses' action is the policy arena comes most easily and naturally through being involved in your state, your nurses association. That's a wonderful way to be involved in policy and legislation in your area so that you have a voice. And so that is your chapter 4. And then I'm going to just move into chapter, let's do chapter 29, where we go into our slideshow, where we discuss our faith-based nurses. Okay. For your faith and community nurses, these are the nurses that are involved not only in churches, or you think the church or any faith-based community organization may have faith community-based nurses for their members or for people in their community. And so they have a close working relationship with individuals and families and the community that utilizes their particular organization. And so you'll see them intimately involved in congregations where they actually work. You may see them again in health ministries or parishes or in congregations. So the faith community is the faith community nurse. She's licensed registered nurse. She has the skills and the personal religious faith of that particular, usually of that particular congregation that she's involved in. Oftentimes she is a member of that religious faith, and that's where she wants to practice. Historical perspective began in the traditional or Judeo-Christian tradition is where it first got its legs. And the healthcare that they provide, the system is often challenging because they have tighter financial constraints working underneath the budget of that congregation to provide care in complex health situations. Oftentimes they say that it's their calling to practice as a faith-based community nurse. And so they follow the same requirements, okay? They follow the Nurse Practice Act for their area, nothing changes there. They have usually an associate's or a bachelor's level degree. And then they focus on the holistic aspect, the clinical, sure, the physical, sure, but there's always that health, that spiritual component that they provide as well, a holistic approach. You may see them at health fairs, or they're providing risk assessments. They're serving that vulnerable population of that congregation, and usually the community that uses that congregation, if they have, let's say, an outreach or for the community, they're there involved as well. And so their faith guides their practice is the best way to really summarize what they do. Sometimes they provide care. There is a paid or unpaid situation, but their focus is holistic in nature. Legal issues, as far as practicing in the faith community, you just have to be aware of laws. This is an area of I would say, of calling, so to speak. They're a specialty type of nursing. Usually this is something that they feel is they're called to complete this type of work. They focus on the healthy people 2020 or 2030 for their area. But again, their population is the congregation that they serve. that is their community. And then we'll move on to our final slide here, which is chapter 30. We're just going to go into, let's see here, slideshow. Our nurse in public health, or home health, or palliative care nurse, and this lovely subgroup of very awesome and amazing nurses. Objectives are listed the same as in your text, and just make sure that when you read your objectives, you feel comfortable with answering the questions, and you know what it's about. So your public health nurses, your home health, hospice, palliative care nurses, they're expanding specialty. They are in high demand. So if this is an area that interests you in serving the underserved, you'll certainly be in good company. Definitions are listed here for you as well. So you want to make sure that you have a comfortable understanding of them. Why these specialty nurses, it just encompasses a wide variety of practice settings, community-based, residences, non-institutional and some institutional setting. So public health and home health, they provide usually short-term skill supportive care and treatment, usually on a daily or weekly basis to elders, those that are ill, those that are disabled, so they can remain out of the hospital setting, and usually they're in their homes. Hospice and palliative care meet the physical, emotional, and spiritual needs of all ages. And then hospice services, they provide end-of-life care. They are the kings and queens of providing care to those that are terminally ill. They do not include curative treatment, so they provide comfort measures and end-of-life services. So you have to meet certain guidelines to be involved, to be a hospice patient, and to be aware that the services they provide are not curative in nature. So families, there's usually a whole discussion about that before they're admitted into hospice services. In contrast, again, palliative care is a wider range of services, not limited to days or weeks. So usually your hospice nurse, there's a, it's a short-term service that they provide for a terminal ill patient, and may include curative treatment. So the difference between your palliative and your hospice services is the palliative care may include curative treatment, where your hospice service does not include curative treatment. And that's just huge to be aware of. So if a family has a hospice nurse, they realize that it's, if mom's oxygen sats, they're keeping her comfortable, but they're not extending life measures to her. Families are involved in the care. They are intimately usually involved in the care. And so there's a lot of teaching and education that goes on as well. Your home health, a little bit about the history that you'll read about in your text, started in the early 19th century. Metropolitan Life Insurance Company included home care as a benefit, and then it's just evolved over time. The focus is primary, secondary, and tertiary, okay? They do education and provide immunizations and what have you, everything that we discussed. You wanna look at your population focus for these nurses as far as the levels of intervention as well. So for home health, primary prevention, the nurses, they can administer, they usually sometimes will bring out, well, oftentimes they'll bring out the annual flu shot to their patients. They'll monitor them as far as the secondary prevention is concerned for helping them as far as for early signs of new health problems to be cognizant of, so they can provide the necessary interventions, like side effects of medications. And then they provide instructions as well with new diagnosis on diabetes, a lot of teaching and education on that tertiary level as well to prevent complications. And so they can maintain the highest level of care possible, whatever prevention that they're focusing on for that particular patient's needs. And so it is a growing specialty area of nursing. It is considered skilled. So your med surg does come into play for your home health nurses. Palliative care, this slide lists the history of it starting in, or officially starting in the 1970s. And so you have a time tree that's shown in your text as well. And so your hospice and palliative care, they're similar as far as some of the services that they provide, and the similarities are listed for you on your slide. The differences are primarily related to reimbursement, what Medicare and Medicaid and what have you insurance companies will and will not cover. And these are things you'll just get to know if you're involved in that type of nursing as well. Because if something's not covered and your patient receives a bill, and then that's an entire different conversation and lecture. So the goal of the hospice movement was to humanize end-of-life experience, to bring dignity or improve that to our folks that were terminal ill. And there's guidelines, again, for being a hospice patient. The goal of the palliative care was quality of life and not restricted based on disease or the disease processes. So as palliative services may be appropriate those with a serious complex illness, regardless if they were expected to recover fully with the chronic illness. And so it's just a matter of where they are with their potential expectancy. I guess that's the best word to put it. So if you're involved in hospice and or palliative care, again, there are guidelines for admissions that, again, you'll know, but keep that in mind as well. Everything is involved with fundings and laws and regulations of the type of clients that they can have. So your nurse family partnership is one of my all-time favorite programs. All of the women that meet the criteria, I refer to them on the reservation, and I can lecture about nurse family partnership and my love for nurse family partnership all day long, but I won't. You'll hear about it more on Friday. You can say that. And then your transitional care nurses, it's just to ensure that continuity of care is taking place. It's the bottom line for transitional care. And then the whole point is that they're trying to reduce the risk of them being readmitted with that particular issue. So they close the gaps, if you will. And so the scope and standards, you want to know your scope and standards for where you're practicing. All right. So you want to be involved, and you want to make sure that you're aware of what you can and cannot do based on your licensure. When in the Omaha system, the best way to explain that is that it came about many years ago, and it's an evidence-based practice framework. A lot of people use this in nursing healthcare fields, so that they have a standard of assessment that everybody follows, and in planning, implementing, and evaluating patient care. It's a standardized way to label problems, how you label your intervention, so everybody's on the same page, if that makes sense at all. It's often used in your community health nursing, home health, and primary care settings. It is used to help healthcare providers assess patient needs, identify appropriate interventions, and evaluate if those interventions were effective. So it's a standardized tool for planning and evaluating and quality improvement and research, so that everyone's on the same page when it comes to identifying and charting and documentation. So it's used as a guide for practice decisions and for documentation. So guidelines for nurses, that's listed here for your slide, that we should all follow from the beginning of our nursing care to the very end. When you're working with, especially in the community setting, you will work with different disciplines. So you want to always have those critical thinking skills, want to be able to coordinate, and always stay on top of your knowledge and your skills, and have a positive attitude. Because at the end of the day, we are, caring for our communities, and we have to work together. So as far as OASIS is concerned, OASIS stands for your Outcomes and Assessment Information Set. It's another standardized assessment tool that is used a lot it's used mostly in home health care. It's used to collect data on your patients, on their health status and their needs. So it's a tool that the home health folks utilize. They evaluate the effectiveness of the care provided for the home care provided by the actual home health agencies. So it's an assessment that's required for CMS and when they evaluate these home health agencies. Again, a lot of the dollars and money and reimbursements and fundings come from different agencies like CMS. And so if they require OASIS to be done, then you have to do it if you want to be reimbursed and pay your nurses and pay your staff. And it must be completed within certain specific times. So if you're involved in home health, you will be familiar with OASIS. Your supervisor will help you to become familiar with OASIS, and it's required by CMS, short line. And so OBQI, Outcome-Based Quality Improvement, is a quality improvement process that focuses on outcome of the care provided by healthcare organizations such as hospitals, nursing homes, and home health agencies. It's a process that enables healthcare organizations to measure and monitor quality care. So a lot of these different systems and programs are about quality improvement, checks and balances, making sure folks are taking care and doing what they're supposed to for fundings and for a lot of different programs. It uses data from a variety of sources like patient outcomes, patient satisfaction, process measures, identifying areas for improvement. It's used to identify and track trends in quality and to measure the impact of changes made to improve care. It's a continuous process. That involves ongoing data collection, analysis, feedback, with a goal of continuously improving in the quality of care that you provide. Many healthcare settings use OBQI, nursing homes, home health agencies, and other providers to measure and improve the quality of the care they provide. And it's also something that's tied to a lot of accreditations as well. So professional development and collaboration, keep in mind that your hospice, public health nurses, and what have you, you're part of a team. And so everyone is working towards the success of their, the care that they provide. You want to have the knowledge and understanding of how processes work. You want to be able to problem solve with your team. You want to be able to understand the differences between client levels of acuity. So you want to have an understanding of all of that. You want to use, communicate clearly. You want to be with your team. You want to communicate without using professional jargons. You want to be confident in your relationships with others and how you express yourself. Trust your colleagues. Be flexible and know that everybody is on the same team. And then the legal, ethical, and financial aspects of home care that's listed here for you. The thing about being familiar with living wills and what have you is that you will come across individuals in your nursing, your community health experience that they want to know more about living wills and they want to have power of attorney. So you want to ask, because if they do, you want to be aware of their desires and their wishes, so that you can follow these. And then going into reimbursements and kickbacks, the bottom line is that fraud can occur and abuse has and can occur in different settings. And you want to keep yourself far away from these particular situations and not be involved in any legalities of Medicare or fraud or what have you. Referrals for doing this, that, and the other, sending patients for this, that, and the other based on kickbacks. And just know that CMS and Medicare and what have you, they have surveyors that come out. So you want to walk that straight line when it comes to ethical issues, legal issues, so you can keep your license for many, many years to come. And as far as trends and opportunities, there's so many different opportunities available that's becoming more and more prosperous these days, especially with telehealth and informatics. So keep an open mind as you go through your nursing program, and just be open and receptive to different opportunities. You never know that you may be involved in nursing informatics or technology. As far as nursing, there's so many different options and opportunities for us outside of the traditional bedside. Just be open and available, and be open and available, and find your passion. Thank you so much, you guys. I will see you on Friday.